So are we going to make any jokes about Aunt Baba having coronavirus?
Don't say that. Just be my guest host, and just
Okay.
do your best. I know you're not ready. Hi, I'm Sylvia Gordon. Rebecca is at home sick. So I have a random agent off of the street.
Ted
Special
from Houston.
guest. Austin from Dallas.
Austin from Dallas.
This is my son, Elliot, that is not prepared to be on the air. He's very nervous. So
I'm not nervous.
Just relax. I know this is
thank you.
intimidating. It's hard to follow in your mom's footsteps. First thing is the testing. So President Trump misspoke when he said, hey, the carriers have all agreed to waive the cost of the testing and the treatment. And all the insurance companies went, WTF? No, we didn't. They agreed to waive the cost of the copay for the test, not for the treatment. So that's what I sent out an email. I said the average cost of treatment for complications of pneumonia, this is from the Kaiser Family Foundation, if you have complications and comorbidities, just love using these big medical
Comorbidities.
terms. Yeah, so it means
Find
if
that
you're
one.
an older person with a bunch of stuff going on, you got some other chronic conditions that easily turns into complications. They said the cost for treatment, this is from the Kaiser Family Foundation, they said is slightly over $20,000. So, yeah, so be sure that it's not been waived. The cost of the test has been waived. Now, how do you get a test?
Beats me.
Right, so they're talking about drive-through testing in Australia and other places. Everybody that I know has not been able to get a test. So we've had several employees, they're like, hey, I have a fever, I have a cough, I went to the ER and they made me go home. Nobody was allowed to get a test, and that's because there's a shortage of tests. You need to contribute here. Okay?
I'm trying to figure out how do I sit in this.
Why don't you put the picture of Elliot's refrigerator up here, the empty refrigerator, and we'll let him contribute a little bit.
Did you post that on Facebook?
Huh?
Did you post that?
I haven't posted it yet, but I'm going to. But, so, the thing about the testing is that you're going to get mad clients that said, oh, no, I got this bill from my insurance, and the president said, and so you need to dial that back. The president misspoke. The major insurance companies agreed to waive the copays for the test, but to get the test, you typically go to your doctor's office, and because it's a lab, even though you can't get them in your doctor's office in most cases. Or you go to the ER, which would be a higher copay. So wherever they're going to try to eventually get these tests, they will pay a copay at that service location, and then they will pay for their treatment. So that's the first thing we got to dial back.
Okay.
Okay, I'll let you contribute now. What is this?
This is an actual picture of my refrigerator on, what was this, yesterday morning?
Yeah, yesterday morning.
I tried to get groceries and everything was out, so I just kind of gave up and
Yeah, so he takes a picture of his refrigerator.
said, Mom, I'm prepared.
Go do the next refrigerator. So I went home and took a picture of my refrigerator. And I go, don't think you're coming over to eating all my food, because you're grown up. Like, you didn't plan for this.
But
Die.
yesterday I found my sources, and I'm partially stocked. It
Yeah.
would be funny to show you what
Hilarious.
fully stocked meant for me.
But I mean, most 26-year-olds, they don't have a lot of food because they
Right.
eat out. And, yeah, but I'm like, don't be coming over here because I got all the good
You
stuff.
got the good stuff.
I got food. Social Security office announced yesterday that they are shutting down service for in-person service. So you cannot go into the Social Security office right now. Yeah.
Whoa, I just had one of the agents tell me that they told
That
the
just came out
client they were
yesterday.
going to be closing.
That just yesterday.
I thought that was
came
in general.
out.
So in person now.
You cannot so
Oh.
you can call them, good luck, but you cannot go in person to your local Social Security office.
CMS has banned visits to nursing homes, which brought up a terrible situation that we heard about in the news where this man had visited his wife every day in the nursing home for how long?
I don't know.
10 years, a long time, and now he couldn't visit her. So he stood outside, had a nice sign that said, I've loved you for 70 years, and I'll keep loving you, something like that. It was heartwarming.
Yeah, it's amazing. You hear some really touching stories right now. But it is a scary time, and there's a lot to be said for the role of the agent because the most vulnerable population are our clients. Right? Our clients, they're scared. And we're still trying to conduct business and help people enroll, and they have deadlines which haven't been waived yet. But everything's on the table. We've heard all kinds of suggestions that might possibly happen with eliminating deadlines and penalties and drug refill limits and out-of-network costs. So there's many things that are on the table that are floating around right now that we will expect to be happening here in the next couple days. Right now we know that since it is an emergency, that the Director of Health and Human Services has the ability to do some things. So he has the ability
to make it so that out-of-network costs on Medicare Advantage are the same as in-network. So they have the ability.
So we don't know if he's going to pull the trigger on that yet, but all things look like they're going to pull the trigger. Now, as far as the insurance companies, they're trying to stay in business. Like clearly the airlines are going to go under, and a lot of people. So the insurance companies are nervous, and they're telling us privately, oh my God, just waiving the cost on the copay for the test, if we have to test everybody, could sink them.
Thanks.
Right? I'm not mentioning any names. Company that told us we were freaking out, and we're not. But we're all in this together. We're all in this. And agents like you that do seminars. So how did this impact your business?
We had a ton of them cancel. At least 10 canceled.
10 of your seminars, not your clients.
Yeah, oh yeah, the actual locations. So we'd already mailed out everything to them, so you can't get those costs back. So it's a negative.
Right, so if you hold seminars, one, the venue said we're out.
Yep.
Two, if you would have held them, who knows if anybody would have shown up. And then in some states, they're not allowed to gather. Some states more than 50 people, some states more than 10 people. So if you're doing seminars, you're done.
And we have people who RSVP'd who the event's now canceled, so we're trying to do a webinar, but besides that, trying to go to people's houses, now they're freaked out.
Right, they're freaked out.
So every in-person, it has it's just not a good time.
Right, so
people are just freaked out.
Those of you that are very versed and comfortable selling over the phone and using e-apps, you're a league ahead of the rest of our agency because the most of the agents in the nation don't do it like that. And they're not comfortable. So now's the time to get comfortable. Call us. We'll do one-on-one training so that you can use our quota and enroll them and do your electronic scopes and as far as possible, do business without being face-to-face. Now, if you have to go face-to-face, and I know yesterday people still had appointments and they wanted them to come, you just take your normal precautions. We all have heard a million times what those precautions are. But it is difficult for everybody to continue to do business when we're working with the population that needs to be isolated, to be isolated the most. But in my opinion, this is a great opportunity for you to get out there before, because I think everything says that it's going to get much worse before it gets better, before you have a lot of clients that might potentially be in the hospital, and explain to them their benefits. Because most of our MedAdvantage clients have never been inpatient.
Yeah.
They have a lab, they have a physical, but they've never had an inpatient stay, and they don't know how that works. And so they're going to have a lot of questions, their families are going to have questions, you're potentially going to be diluted with questions. Get out ahead of that. This is what social media is meant for, is to put valuable information out there and get to a lot of people and be helpful, not misleading, not incendiary, but actually helpful information. If you need some ideas for some helpful posts, I have a little paper I can send to you. Just some simple posts that, because all of a sudden you're going to have people calling you like crazy, and there's only so much.
Hospital indemnity plan.
There's only so much of you that you can handle. But they still, even if they have wonderful coverage, they don't know how it works.
Yeah.
They don't know how this is going to work. When do I have to pay this?
Yeah.
How did this copay? If I'm in the hospital, do I also have to pay for a specialist and a lab and an x-ray? Do I also have to pay? They don't know how it works. MedAdvantage is very confusing. Even if they have Medicare supplement, they're still going to be nervous. So this is a great time to send out emails, blasts, do ringless voicemail, go to social media to put out some information out there and let them know you're their trusted advisor. This is where you shine. You're here in an emergency to help them understand the most important thing in their life right now, which is their health insurance. So yesterday, I had a lot of kids home from school, so I decided to put my niece, this is Rebecca's daughter, Evelyn, to work, and I commissioned her to make me 4 cakes, because she's a cake baker. If you'd like to check out her channel, it is Baking with Evelyn on Instagram. So I commissioned 4 cakes. Yes, if you want to come over, I will share some cake with you.
That's what I'm thinking. Who needs groceries?
The dog jumped up on the counter and ate about 1/4 of the vanilla cake. That was a dairy-free cake for my daughter who has allergies, and she ate the whole entire cake because she can never eat sweets. So yeah, it's gone. This cake is still available, and of course my poppy seed cake is still available, but I'm highly rationing it to only close friends and loved ones because I love that cake. But, you know, everybody's doing their best to get through it. We're still here. We have a lot of our staff at Gord Marketing that are working from home. We have, like I said, several members that are sick, but in general, most of us are at work trying to help you in any way we can. So be safe, do everything you can for your clients out there on the front lines, and call us if we can be of any help.